In the previous video, for lecture 29, we finished up by summarizing the factors that increase VO2 max with exercise training. And I wanted to add on to that a little bit today by looking at how those adaptations will compare in a trained versus an untrained person, and particularly 4 or 5 cardiovascular variables. So let's do that through looking at some graphs. First, let's take a look at how training affects VO2, and particularly VO2 max. On our x-axis here, we have power or workload. You could also use something like running speed. And then on the y-axis, we have VO2. This would be, say, liters per minute. And our numbers here in liters per minute, we're going to have 0. And let's say VO2 max of maybe, I don't know, someone's pretty highly trained, might be 70. And for power, let's go up to something like 400 watts. And so if we have an untrained person, we know at rest they're going to be somewhere down here. And then they're going to reach a VO2 of about 35, something like this. And then they'll plateau, right? So that's going to be your untrained person. If, however, I'll do a different color here. If we have a trained person, their VO2 is going to be the same as the untrained person at any submaximal level, so they'll follow this line. It might be slightly less, they might be more efficient, but overall the oxygen cost should be about the same regardless of the power output. Now the difference, of course, is this trained person is going to be able to go higher and then eventually reach a plateau out there. And so now the difference is that the untrained person plateaus at that power output, but the trained person who can generate more power and reach a higher VO2, of course, will just keep going. Next, let's look at how heart rate changes with training. If we have an untrained person at rest, their heart rate will be about 70, and then they'll go up to about 200 heartbeats per minute, something like that. A trained person, of course, is going to have a lower heart rate at rest and all the way through submaximal exercise, and even maybe a little bit at max, right? And so the trained person might look like this. So again, achieving a higher output, but also having a lower heart rate at any given power output along the way. Next, let's look at stroke volume. We know stroke volume is going to be different at rest and during submaximal exercise, and as well as at max. If the untrained person has a resting stroke volume of somewhere 70, they would increase to something about 100, maybe 110, up through 40% of their VO2 max, right, and then plateau. A trained person is going to have a higher stroke volume at rest, maybe even substantially so. Also, perhaps show a plateau, but it'll be at a much higher level, and again, we'll achieve a higher power output. So that's your trained, and there's your untrained responses. So now we've done heart rate and stroke volume, so let's take a look at cardiac output. And so here we have on the y-axis cardiac output, or Q, liters per minute, 0 to 35, and then the same power output on the X. The untrained person, we know, resting cardiac output is going to be about 5, and maybe gets up to about 20 at max. Something like this. Actually, let me erase that. It's not a very clean line. There's going to be your untrained response for cardiac output. And now the trained person, of course, think about this. Heart rate was a little higher in the untrained, but lower for stroke volume, right? And vice versa for the trained. And VO2, remember, was the same at any submaximal power output. And think about what the purpose of cardiac output is. Cardiac output is for oxygen delivery, and it's going to very closely match the oxygen needs of the muscle. And so for cardiac output, it's going to look just like the VO2 response, and that is it will follow the untrained person, of course, then go to a higher maximum workload, a higher maximum cardiac output before a plateau. And that's the trained person. Finally, let's take a look at one last cardiovascular variable, and that will be AVO2 difference, or the oxygen extraction at the tissues. This is also going to look a lot like cardiac output. So at rest, we know AVO2 difference is about 5 milliliters of O2 per 100 milliliters of blood, and an untrained person might reach up to about 15 or so, and so it might look something like this. Now, the trained person, of course, will look along a similar line, but then be able to reach a higher AVO2 difference at a higher power output. So that's the trained, and there's your untrained. So those are the primary cardiovascular variables and how they change with exercise training in a trained versus untrained subject.